Yeah, these are things people have said right before dying. And I'm going to be really specific, dying from a cerebral aneurysm. And I'll even throw in blood clot in there too. So if you don't know what a cerebral aneurysm is, it's a rupture. It occurs suddenly, like in a subarachnoid hemorrhage. And the hallmark symptom is this severe explosive pain in the head. It peaks within seconds, and it aligns with about 50% of cases that when this happens, they immediately collapse and die, or death is imminent within minutes or hours. You may have had a friend or a family member that have had this exact thing. I remember I had a colleague whose daughter actually died this way, and it was horrific. It really was. And I thought, well, it's probably a good thing to talk about, because if you ever hear someone say this, you don't have much time, call 911. So patients may verbalize the pain intensely before losing consciousness. That's why if they say something like this, it gives you a clue. Is this a cerebral hemorrhage or aneurysm? Okay, because if you don't get them help quick enough, they can immediately go into coma, brain swelling, or even death. It's not going to be your fault. It's not your fault. But if you can recognize these things that they say, maybe you can help save someone. Okay, so the first thing is what we see with cerebral hemorrhage, what patients say right before coma or death is, they might say, oh my gosh, this is the worst headache I've ever had. Or it feels like my head is exploding. And that comes out of the blue. Like they were fine an hour ago, and all of a sudden their head feels like it's exploding. And I'm not talking about what like a child might say, because when children talk about headaches, they describe it in really dramatic ways, and dramatic people describe it in dramatic ways. But if you know this person doesn't talk that way, you got to take that serious. So what else do they say? They say, my chest hurts, but my brain feels fuzzy. That's a quote from someone that had that issue before dropping dead from a massive aortic aneurysm. Now, again, this is a vascular issue. Sometimes it's a similar type of rupture. The aorta is right here, and that can rupture as well. And then down in the abdomen, the abdominal aortic area right there can rupture as well. It's called a AAA. Aortic abdominal aneurysm. Yeah, those can rupture well. In fact, John Ritter from the show Three's Company, that's how he passed. Sudden. As the pressure builds, some will say, I just don't feel well. Something's wrong in my head. They've said that too. Or I don't feel well. And then the rupture occurred in death within a minute. Yeah. You can't always catch it. But the thing is, here's another quote. Someone said, help my head. And then they vomited, had a seizure, and passed away. Yeah, these are really, really rare. I mean, I've actually never seen this in person. I've only heard about stories of patients this happened to, luckily. So the calls for help or confusion are pretty common after they experience the headache. Some have even described it as like a thunderclap, like just boom in their head. And so the pressure keeps building and building, and that's where there's just this window of time to get them help. In fatal ruptures, though, speech may be limited. They might just grab their head, but they can't verbalize anything. It's just too quick, too painful. And, it's very common for patients to just collapse right after that sudden headache, after the initial complaint. So sentinel headaches are kind of your warning. They're little leaks that happen days or even weeks prior to the big sentinel event. And so they might just say they're having severe headaches, and it's happening days or weeks prior to the big one, and they don't normally have severe headaches like these. Think of cases where your loved one or your patient seems fine, everything's going well. All of a sudden, they're complaining of intense headaches or head pain, and they don't have a fever. There's no stiff neck, so, no meningitis, nothing like that. No rash, because again, this would signal something else, right? It's just this intense. Why does my head hurt so bad? Why does it feel like there's a bomb going off in my head? Yeah, that's what I'm talking about. That kind of intense headache. Okay. Now, when it comes to a blood clot, so that's a little different, right? People can get a blood clot in their legs that can dislodge and end up in the heart. There can be a blood clot in the lungs. We saw that a lot with COVID and the treatments. Yeah, afterwards, a lot of blood clots for sure. So how is that a little difference? Well, a lot of patients will more complain of chest pain or breathlessness with this kind of blood clot. So they'll say, I can't breathe, or my chest hurts. Or in medical school, they would always tell us, like, if the patient tells you like words that like a sense of doom, like they have this sense of doom. Yeah, that's how they used to teach it to us. So one survivor who had a blood clot said he felt like he had run a mile and couldn't catch his breath. There's a type of a blood clot here in the lungs. We call it like a saddle blood clot because it's just right at the middle hilum and it's just kind of extending to both sides of the lungs. Yeah, there's different kinds. So patients that have DVT or deep vein thrombosis or a blood clot in the leg, like I said, it can dislodge and end up in the chest, leading to discomfort, breathlessness, things like that. However, in about 25% of pulmonary embolisms or blood clots in the lungs, patients may present without any prior symptoms. Like the person could be fine. All of a sudden, they're having extreme chest pain and then pass away. Yeah. So a lot of patients with this will say they're having a lot of fatigue, they're really tired, having unexplained anxiety when they have this because, yeah, their oxygen is dropping. So they're getting more tired because there's a blood clot in their lungs. Yeah. So they'll say something's just not right with me. And you'll notice that they're breathing more rapidly. And I'm not talking about a panic attack. This is very different because in a panic attack, they'll have shortness of breath and almost like a heaviness of their chest. But panic attacks resolve somewhat quickly versus this does not resolve. And the pain can worsen with this one, which leads most people to end up going to the ER. And then they do imaging and they find, oh, yeah, you have a blood clot in your lung. That's what's going on. So in hospice, though, what we see with chronic clots, patients might have end-of-life sentiments. But again, an acute pulmonary embolism is still rapid. So in one ICU case, a patient with massive clots was basically suffocating to death, but there was really no verbalization going on there. It was more just the suddenness of the story or of the symptomology going on. And that's why I want to highlight that blood clots, aneurysms, aortic ruptures, this is all very, very, very serious. Luckily, for the most part, it's pretty rare. I did find out that my biological grandmother, did die from a AAA, an abdominal aortic aneurysm. And it's interesting because I hold all my weight around my middle. So even though I try to keep my weight under control, I try to work out, that is where my weight goes. It goes to my middle, which in addition to my cholesterol that I have to keep an eye on too, ups my risk because if you have fat around your middle, it ups your risk for cardiac events, blood clots, and things like that. But there's so many other things that up the risk too. So something to be aware of. Yeah. So thank you. Hope that was helpful and interesting. And I thank you for being here, and I'll see you on the next one.